still wrong. Hey, have a quick question. Have you learned a few things in this video so far? If you have, I'd really appreciate it, if you aren't subscribed yet, to subscribe and come back to see the video that I post next month too. I make these videos for fun, and I do them because I genuinely like to. It's always one of the highlights of my day. I've published on average one a month every month since 2017, and I do these to teach how we think in medicine by telling stories of patient cases. I'm very thankful to have the opportunity to make these for you. Appreciate you. 20 months after treatment, which is 4 months before he's presenting to the emergency room, K.A. went on a hiking trip with his wife. In the evenings, after they were done, he'd notice welts all over his arms and legs. They were itchy, sometimes painful. The trip was like this every day, but he was totally fine when he got home. A few weeks later, he started seeing flashing lights. He thought maybe he hadn't gotten enough sleep, but then a horrible pain emerged on the left side of his forehead. At the hospital, doctors did a brain MRI. Nothing was found. Everything was normal. His kidneys were healing, but blood tests suggested that he was dehydrated. They gave him IV water. 2 days passed, and he got better. They sent him on his way, but very clearly, dehydration wasn't his problem. A week later, K.A. was back in the hospital because his speech was nonsensical. He was confused. He didn't know where he was. One kind of stroke is when a blood clot gets lodged into a blood vessel of the brain. This chokes off blood flow and starves that part of the brain of oxygen. There's just minutes before permanent damage settles in. When doctors did imaging of K.A.'s brain, it kind of looked like he was having a stroke, but it wasn't clear. It was borderline. But there was no time to wait. Medicine that immediately breaks blood clots by thinning the blood were given. It seemed to work. K.A. got a little bit better, but he appeared to still have problems. It was hard for him to find the right words to say, and he was still confused. But by that hospital administration's metrics, he was good enough to go home. No more immediately life-threatening problems, so let's schedule you an appointment for follow-up. And he was on his way. As the weeks passed, K.A. started seeing floaters on his left side. He had to lay down in bed with an eye mask because the light would make him feel like a hammer was smashing his skull. He had to wear earplugs because all sound would amplify and echo. At the ophthalmology eye doctor's office, K.A. was found to have eye inflammation. The left was worse than the right. The pattern and where the inflammation was inside the eye were very specific. And this was concerning. K.A. had a history of his immune system attacking his kidneys. If his eyes have inflammation, this could mean that it's attacking his eyes now. K.A. was given steroid eye drops. A mixed sedative, Tylenol, and caffeine combination pill were given for his headache. This calms down the brain, reduces inflammation, and constricts blood vessels going to the brain to limit excess blood flow that could cause headache. In over 2 weeks, K.A.'s pain went away. His vision improved. He didn't need to wear the eye mask anymore. But a week later, K.A. suddenly felt weak on the right side of his body, and the right side of his face was drooping. He could only slur his words. At the hospital, again. Clinically, it looked like he was having a stroke again, but brain imaging returned normal.